Cathaoirleach, and good morning, Minister. Thank you for taking the time to be here to hear statements on the important issue of mental health. COVID-19 has posed fundamental challenges for people's mental health, as many individuals have experienced heightened stress, anxiety, fear or panic. We have come through a very dark and dreary winter, and we must be proactive to help people through these difficult times. The COVID-19 pandemic and its restrictions have been challenging for people in our society. People are social by nature, and restrictions that have reduced human contact have been particularly difficult. People miss their community, friends, extended families very dearly, and talking about our mental health and monitoring the mood of the public is critically essential, Minister. It is okay not to feel okay during this period. This time is difficult, but we will get through this. And as part of the response to these challenges, the Government has provided guidance and support for people to manage both their physical and mental well-being and to stay connected. Significant funds have been allocated to the Keep Well campaign, with €7 million to support the delivery of a range of actions and support services which will be rolled out over the coming months. Isolation of people of all ages is a significant risk during the COVID pandemic, particularly during periods of tight restrictions on movements and social interactions, Minister. The Community Call programme was introduced in mid-2020 to provide local helplines through local authorities for practical supports, information sharing and befriending. And this has been exceptionally successful, in my view, from people who spoke to me, who have interacted with these platforms. Working with partner organisations, including An Garda Síochána, NGOs and Volunteer Ireland, there is a particular emphasis on identifying and supporting those most at risk of isolation. I want to make the message clear. You are not alone in this, and people are here to help you. I would also like to again highlight the use of social bubbles. People in certain categories can form a support bubble with one another's households. Those who can form a support bubble include those alone with children under the age of 18, those living alone and those sharing parenting or custody arrangements, those living with an adult to whom they provide care, and those who live alone and have a carer or carers who support them. These times are difficult for everyone. There is no doubt about that. We need to try and do our best to get through this. Look out for those who are isolated in our communities. Stay connected with those in your community, and don't be too hard on yourselves as well, which is also quite important, because I think we have to accept the fact that the last number of months now have been extraordinarily difficult for everybody. I don't think anybody has had an easy ride through this pandemic. It's been quite a challenge, and I think as the youngest member of Dáil Éireann, Minister, I have to say that a lot of young people are suffering out there. We're quite conscious of that, and unfortunately it will be some time yet before we will be back to some degree of normality. And I'd be quite conscious to insist that the Government would continue to monitor the national mood for people who have never experienced any mental health difficulties and that are now, I suppose, feeling isolated and lonely. And I can tell you from interaction with people in my own age group who were supposed to be going out into the world and starting their lives as young professionals after finishing up college education, many of those are reporting to me they're feeling lonely and isolated. And I think we have to show considerable focus in that particular area. And I continue to wish you well in your department. I know you're doing a lot of significant and good work. So thank you very much.